You've probably had surgery, or you know someone who has, and if you have, you know the feeling. The mask goes over your face, the anesthesiologist tells you to count backward from 10. You get to 7, maybe 6, and then nothing, not darkness, not sleep, not even the sensation of time passing, just nothing. And then suddenly, without any transition, without any warning, you are awake. The surgery is over, hours have passed, and you have absolutely no memory of any of it, not a dream. Not a flash, not even the awareness that time passed at all. Where did you go? That question sounds like it should have a simple answer. You were unconscious, the drugs knocked you out, your brain shut down, simple, except here's the problem. That explanation is wrong, not partially wrong, not missing a few details, fundamentally, deeply, scientifically wrong. And the real answer, the answer that the most brilliant neuroscientists and consciousness researchers in the world have been chasing for over 180 years, is so strange, so unsettling, and so far beyond what most people expect, that it changes the way you think about what you actually are. Because here's what nobody tells you when you sign the consent forms before surgery. We have been putting people under general anesthesia for 180 years. Over 300 million people receive it every single year. It is one of the most common medical procedures in the history of human civilization, and we still do not fully understand how it works, not completely, not satisfactorily, not in a way that the scientific community has reached consensus on 300 million people a year, 180 years of practice, and at its core still a mystery. Let's start at the beginning. Because to understand where you go under anesthesia, you first need to understand what anesthesia actually is. And most people think they know. Most people are wrong. The word anesthesia comes from ancient Greek. It means without sensation. And for most of human history, that is exactly what surgeons were trying to create, a state in which the body could be cut into without the patient dying of shock or pain. Ancient Egyptians used opium preparations. Ancient Greeks used mandragora root. Medieval surgeons used alcohol, sometimes in quantities that killed the patient before the scalpel did. For thousands of years, surgery was a nightmare, not a procedure. A nightmare of screaming, physical restraint, and speed. Surgeons before anesthesia were not valued for their precision or their knowledge. They were valued for how fast they could cut. The faster you finished, the fewer seconds the patient had to endure what was happening to them. Then on October 16, 1846, at Massachusetts General Hospital in Boston, a dentist named William Morton administered ether to a patient named Edward Abbott. A surgeon named John Collins Warren removed a tumor from Abbott's neck. Abbott felt nothing. When it was over, Warren turned to the audience of medical students watching and said simply, "Gentlemen, this is no humbug." It was one of the most important sentences ever spoken in a hospital. It meant surgery would never be the same again. But here is what nobody in that room understood. Nobody in that operating theater in 1846 knew exactly why ether worked. They could see that it did. The patient went under, the surgeon cut. The patient felt nothing and remembered nothing. But the mechanism, the actual biological process by which a chemical agent removed consciousness from a living human brain, was a complete mystery. And here's what should genuinely stop you in your tracks. In many of the most important ways, it still is. So what do we actually know? What happens to your brain when anesthesia takes hold? The physical picture is actually quite detailed. When general anesthesia takes effect, several things happen to your brain simultaneously. First, the thalamus goes quiet. The thalamus is a small, almond-sized structure buried deep in the center of your brain that acts as the brain's primary relay station. Everything you see, hear, feel, and sense passes through the thalamus before reaching the cortex, the outer layer of the brain where conscious processing happens. Under anesthesia, the thalamus essentially shuts down. It stops forwarding information. The outside world stops arriving. Second, and this is the part that neuroscientists find most significant, the communication between different regions of your brain breaks down. Under normal waking conditions, your brain regions are in constant, extraordinarily complex conversation with each other. The visual cortex talks to the frontal lobe. The frontal lobe talks to the temporal lobe. Memory systems communicate with sensory systems. The whole thing is a symphony of coordinated firing, and neuroscientists believe that this coordination, this complex, integrated communication across brain regions, is what generates conscious awareness. Under anesthesia, that conversation stops. Individual regions continue to show electrical activity. They are not dead, they are not silent, but they stop talking to each other in the coordinated way that consciousness appears to require. Third, a specific pattern of brain activity takes over large, slow waves called slow oscillations that sweep rhythmically across the cortex. These waves look completely different from anything seen in normal sleep, normal wakefulness, or any other natural brain state. They are not the waves of a brain that has simply powered down. They are the waves of a brain that is doing something, something active, something organized, something that science has not yet been able to interpret. And this is where the story gets genuinely uncomfortable, because the anesthetized brain is not a silent brain, it is a busy brain. It is a brain that is actively doing something that produces no reportable experience, no memory, no sensation, and no awareness, or at least no awareness that the person can later access. What it is actually doing during those hours remains one of the most contested and unresolved questions in neuroscience. Now here's the pivot, because everything we've talked about so far is about the brain, the physical organ, the neurons and the chemicals and the electrical signals. But the real mystery of anesthesia is not a question about the brain. It is a question about consciousness. And consciousness is where science runs into a wall so solid that some of the smartest people in the history of human thought have walked into it full speed and bounced off. Consciousness, your inner experience, the sense of being someone, the feeling of seeing red or hearing music or tasting coffee, is what philosophers call the hard problem. And they don't use the word hard casually. They mean something specific by it. Every other question in science is in principle answerable by studying physical processes. You can always, at least in theory, tell a complete physical story about any physical phenomenon. How the heart pumps blood, how the immune system fights infection, how neurons process visual information. You can map every molecule, every electrical signal, every physical event, and at the end you have a complete physical explanation, but consciousness breaks that pattern. You can tell a complete physical story about everything your brain does, every neuron that fires, every chemical that releases, every signal that travels, and at the end of that story you still haven't explained why there is something it feels like to be you. Why the experience of red is red and not blue. Why the experience of music sounds like anything at all rather than just being an electrical pattern in tissue. The physical story describes the process perfectly. It doesn't touch the experience. And that gap, the gap between the physical process and the inner experience, is the hard problem. Named by philosopher David Chalmers in 1995. And still completely unsolved today, this matters for anesthesia because what anesthesia does at its most fundamental level is make that inner experience disappear. It doesn't just block pain. It doesn't just paralyze movement. It removes the experience of existing, the awareness, the sense of self, the you. And if we don't know what consciousness is, where it comes from, or what generates it, we cannot fully explain what it means for it to vanish. We can describe the brain changes. We cannot explain the disappearance of the experience. Now here's the part of the story that most videos skip entirely. And it is the most disturbing part, anesthesia awareness. Every year between 1 and 2 patients per 1,000 who receive general anesthesia wake up, not after surgery but during it. They regain consciousness while the procedure is still happening. They can feel what is being done to their body. They can hear what is being said in the operating room. And they cannot move, cannot speak, cannot signal in any way that they are awake, because the paralytic agents that are routinely given alongside anesthetics prevent all voluntary muscle movement. These patients are fully conscious, fully experiencing, and completely trapped. This is not a myth. It is not an exaggeration. It is a documented, studied, peer-reviewed medical reality. Researchers have interviewed these patients, collected their accounts, studied the psychological aftermath, which often includes severe PTSD, and what these accounts reveal is something that should fundamentally change the way you think about what consciousness is. If consciousness can persist even when every external sign of consciousness is gone, even when the brain appears to be fully anesthetized, even when the EEG shows slow oscillations, even when the thalamus is suppressed, then what exactly is consciousness? Where exactly does it live? Is it something the brain generates the way a generator generates electricity? Or is it something more fundamental, something that the brain accesses or channels rather than produces, something that can persist even when the physical equipment appears to be offline? Neuroscience does not have a consensus answer. It has competing theories. The integrated information theory, proposed by neuroscientist Giulio Tononi, suggests that consciousness is a property of any system with sufficient information integration, and that it exists on a spectrum, present in varying degrees in everything from human beings to simple organisms to potentially even basic physical systems. The global workspace theory, associated with Bernard Bars and Stanislas Dehaene, suggests that consciousness arises when information is broadcast widely across the brain's neural networks, creating a global workspace that makes information available to multiple cognitive systems simultaneously. Under anesthesia, this global broadcast shuts down, which would explain why consciousness disappears. But both of these theories and every other serious theory of consciousness that currently exists run into the same fundamental problem. They can explain what the brain does differently when someone is conscious versus unconscious. They cannot explain why those brain processes feel like anything at all. They can describe the mechanism. They cannot explain the experience. And until that gap is closed, the question of where you go under anesthesia remains not just medically uncertain but philosophically unresolved at the deepest possible level. Here is something that researchers have found that adds another layer to all of this. Near-death experiences. A significant percentage of people who are clinically dead, no heartbeat, no brain activity by conventional measurement, for periods of several minutes report experiences during that time. Experiences of extraordinary clarity and vividness, feelings of profound peace, sensations of leaving the body and observing it from above, encounters with light, with other presences, with environments that feel more real than ordinary waking life. These accounts come from people of every culture, every religion, every background, from people who had no expectation of having such an experience, from children too young to have absorbed cultural narratives about what death is supposed to look like. And they are consistent in ways that researchers have found impossible to simply dismiss. What they suggest, and this is deeply contested, deeply controversial, and not accepted by mainstream neuroscience, is that consciousness may not be entirely dependent on brain activity for its existence, that it may continue in some form even when the physical brain has stopped functioning. That what we experience as consciousness may be something more fundamental than the brain processes that normally generate our awareness of it. The brain in this view is not the source of consciousness. It is the receiver, the tuner, the instrument through which something more fundamental expresses itself in the physical world. And when the instrument goes offline, whether through anesthesia, through clinical death, through deep dreamless sleep, that something continues in ways that the instrument cannot record or report. This is not the scientific consensus. Let me be absolutely clear about that. Mainstream neuroscience holds that consciousness is generated by the brain and is dependent on brain activity for its existence. But the hard problem remains unsolved. The phenomenon of anesthesia awareness remains unexplained. The consistency of near-death experiences across cultures and contexts remains a genuine scientific puzzle. And the honest position, the position that the evidence actually supports, is not certainty in either direction. It is deep, genuine, scientifically appropriate uncertainty about one of the most important questions that human beings have ever asked. So where do you go under anesthesia? The honest answer is this. Your thalamus shuts down. Your brain regions stop their complex, coordinated conversation. Slow oscillations take over your cortex. Your ability to form memories disappears almost completely. And the inner experience, the sense of being you looking out at the world, goes somewhere that science cannot currently follow. Whether it disappears entirely, whether it continues in some form the brain cannot access, whether consciousness is something the brain generates or something more fundamental that the brain normally channels, these questions do not have scientific answers yet. What we do know is this: the you that went under comes back. After hours of chemical disruption, after the complete breakdown of every brain process associated with conscious awareness, the same memories are there, the same personality, the same sense of being specifically you and not someone else and not nothing. That continuity of self, that survival of the you through the chemical storm of anesthesia, is itself something that science cannot fully explain. How does the self persist through that? What preserves it? What ensures that the person who wakes up in the recovery room is the same person who counted backward from 10? Nobody knows. Not the anesthesiologist, not the neuroscientist, not the philosopher of mind, not the consciousness researcher who has spent a career studying exactly this question. The mystery goes all the way down. Every single day, 300 million times a year, human beings go somewhere that science cannot follow, and they come back as themselves. And nobody can fully explain either half of that sentence. Next time you count backward from 10, remember that you are about to go somewhere that humanity has been sending people for 180 years. We still don't know exactly where it is. We just know that so far, for most people, the way back has always been there so far.